call Mr. Michael Copeland.
Thank you, Mr. Principal Deputy Speaker. The human mind, no matter how undamaged or damaged by experience and by life, is more complex and more valuable than the most expensive computer ever built or ever likely to be built. And when it goes wrong, it is very, very hard to fix. Mental illness has been around for a very long time, and it was treated differently in the past in some ways because the availability to treat it was different. My father, upon being promoted to a shipyard foreman, went in on the Sunday before he was due to start his new job on the Monday, and the man, who I'll call Sammy, indicated to him that he wanted to speak to him. And my father went over and Sammy congratulated my dad on his promotion and put forward to him the view, "Mr. Copeland, I'm the only sane man in Harland Wolf." And my father, intrigued, asked how he could make such a statement. And he pulled from his pocket a sheet of paper given to him when he had left Purdysburn, as it was then, stating that he was sane. My father, in the twilight of his life, said to me that if the whole 37,000 men who worked in that place at that stage had been lined up, it was true that he was probably the only one who could prove that he was sane. He benefited from employment, from a society which was different in its nature and its hopes and its aspirations to that we currently inhabit, and he made his way in the world. Today it's different. How, sir? How, in the name of God, in the 4th provincial capital of the 7th wealthiest nation on the face of this earth, is it possible for a son or a daughter of this city living less than a mile from here, having suffered an incident in their childhood, to get to 22 years of age and have received no help that amounted to anything? To find yourself deprived of the £57 a week that the state says you need to exist, or the value that the state puts on you, reduced to living in a 3rd-floor flat with no gas, no electric and no food, making toast with candles. This system does not cater well for those who suffer mental illness. It leaves them in a cold, dark, lonely place. Some survive, some do not. I think of a son of this city, buried Saturday week ago, 31 years of age, contributed, worked all his life, lost his job, applied for state support through disability living allowance, which in my view he was entitled to. He visited my office asking could I represent him at an appeal. Unfortunately, it was on a day that the committee sits in here and I couldn't. We agreed we would get it rejigged, but he couldn't wait. He had literally given up. I know sometimes I think I'm the only one that gets cases like this, but I know I'm not. I know we all have them. And I know the guilt that we all bear and feel when someone does something that we think ourselves we could have prevented. The Troubles bear a responsibility for a lot of the current situation, but they're not solely to blame. The impact of welfare reform, Westminster legislation brought over here, converted to a Northern Ireland Executive Bill, almost verbatim, in my view, does not adequately address the differences that exist in the nature of our society, the structure of our society, and most importantly, the history of our society. Those who suffer mental illness generally do so alone. Many are not capable of earning a living, and many turn to the temptations of life to blind the sorrow, be it drink or drugs or company, which does them no good. If this centre can save 9 lives, the saving to this state, according to a figure the Minister gave me some time ago, at £1.5 million per suicide, then it is money well spent. If we in this place can do something, anything, that alleviates the loneliness that those suffer, then they shall have been well served.
Thank you very much.